Hello and welcome to my Osteopath Judith. We all know the pain a baby goes through when they suffer from colic, and we empathise with parents going through what can be a very difficult and distressing time. In today's video, which is the first part of a two-part series, I'm going to give you 4 tips which may help you relieve the symptoms of colic, and I'll go through some practical examples which you can do at home. I'm Judith O'Sullivan, Principal Osteopath at the Mallow and Fermoy Osteopathic Clinics in County Cork, Ireland. And today we're going to be improving health and enhancing lives. Colic is defined as crying for at least 3 hours per day on at least 3 days for at least 3 weeks. Colic usually begins between the 2nd and the 6th week of life. Every baby is an individual, but the following are some signs and symptoms that a baby may present with if they have colic. A baby may have flushing of the face, changed posture, for example, arching of the back, drawing their knees to their chest, or clenched fists, crying unconsolably for no apparent reason, high-pitched screams, bloating of the belly, interrupted sleep with episodes of crying. Feeding may be interrupted and irregular. Unfortunately, all of these symptoms can result in your baby being quite uncomfortable and distressed. And as all babies are unique, we have to be aware that some babies will present with differing symptoms. For example, some babies may experience bloating of the belly and excessive wind, while others may have trouble breaking their wind. The cause of colic is unknown. There are some theories out there that it may be related to food sensitivity or an immature gut. At birth, a baby's digestive system is still developing and maturing. They may have food sensitivities. For example, if babies are on formula, their immature gut may find it difficult digesting the protein, which can cause tummy issues. During birth, if there has been a prolonged labour, a very fast labour, or the use of forceps, any of these issues can cause dysfunction and restrictions in the newborn's body. These restrictions can have an effect on the proper functioning of the nerve that goes to the gut. When I'm in clinic, the following are 4 tips that I recommend parents which can help ease the symptoms of colic. Tip number 1, feeding little and often. Obviously, this depends on the age of your baby and on the recommended quantity of fluid ounces they should be getting on a daily basis. Breastfed babies are recommended to feed on demand. Also, babies will feed more during growth spurts. With babies that have reflux, it is advisable to feed little and often, as this can cause less pressure on the stomach muscle than a large, sudden intake of food. When you're feeding your baby a small amount, it gives the stomach a chance to digest the food and help keep the contents of the milk inside the baby's belly. So what happens with the stomach contents when a baby is refluxing? The food comes from this area up through the valve of the sphincter, the lower esophageal sphincter, through the esophagus, up into the throat and into the baby's mouth, which can be quite distressing for babies. Tip number 2, elevate your baby after their feed. As we mentioned in tip number 1, in infants, the ring of muscle between the esophagus and the stomach, known as the sphincter muscle, the lower esophageal sphincter, is not fully mature. As the baby gets older, this sphincter muscle matures and will only open when your baby swallows and remain closed at other times. After feeding your baby, to help reflux, put your baby in an elevated position for 30 minutes, either on the parent or guardian's chest, or if they are old enough, in their bouncer. So just taking their baby up and putting them on your chest is a really, really good position for them. So just lying them on your chest, or if the baby is old enough, elevate it up in the bouncer, which will be an elevation of about 70 degrees. Tip number 3, using a pacifier. If breastfeeding, make sure that breastfeeding is well established, usually 3 or 4 weeks before introducing a pacifier. Infants who suck on a pacifier may have fewer and shorter episodes of reflux due to stimulation of saliva and the resulting swallowing action. The acidic contents, which are travelling up towards the throat, are swallowed back down towards the stomach. If there has been a traumatic birth, for example the cord around the infant's neck or the use of forceps, there may be a restriction into the jaw joint or the muscles of the face or the anterior throat, which may affect sucking when a baby is trying to feed. Mums can perform exercises with the pacifier by gently trying to pull the pacifier in and out of the baby's mouth, therefore loosening all the muscles around the cheek and jaw. This promotes more effective feeding and helps provide a good seal around the breast or bottle. If the baby is forming a good seal, they're not losing milk out the side of the mouth and therefore not taking in air, which can cause excessive wind in babies. Tip number 4, bicycle kicks. Some babies have tension into their lower back and pelvic area due to restrictions into their hips. There can be a number of different reasons for this. For example, they may be in a breech position for a number of weeks towards the end of the pregnancy. By gently moving their legs forwards and backwards and in a circle, this helps loosens the muscles and nerves of the legs, hips and pelvic area, which can also help break their wind and stimulate and regulate their bowel, which in turn helps some of the symptoms of colic. So you can do this either with the baby on your lap, or you can lie the baby down but in an elevated position. So lie them on 2 pillows. So you can do gentle circular movements into the hips. Very gently, you never ever force a movement. And then you can do flexion extension, bicycle kicks. Okay. And you can also move their foot towards their nose. So whenever you're doing it nice and gently, going to the baby's rhythm. Okay, never ever forcing a movement. And babies will love this. In part 2, I have 5 more tips to share with you. So subscribe to my channel and click the bell to stay notified of that upcoming video. Thanks for watching, guys. It's all about improving health and enhancing lives.